Good morning, I'm Dr. Sarah Smitty-Youssef here at HMG Pediatrics. I'm here to discuss screen time and mental health in children. We're going to be talking with two behavioral specialists from Frontier Health today. In 2020, we know that kids have had way more screen time than ideally we would like them to have. And today we're just going to talk about some strategies of dealing with virtual school, good screen time versus detrimental screen time, and how to help preserve your child's mental health.
My name is Brandy Maltzberger, and I'm a behavioral health educator for Frontier Health. And we're here today to talk about screen time with your children, and we're going to focus on three different areas: toddlers, school-aged, and teen. So to talk about with the toddlers, there is an American Academy of Child and Adolescent Psychiatry that has recommended that for toddlers aged 2 to 5, that they only have 1 hour of non-educational screen time per weekday and 3 hours of non-educational screen time on the weekend. So we know that we want to limit as much screen time as we possibly can with our toddler group. We want to provide more one-on-one interaction with that age group. So limiting that screen time is very crucial and important. And so some of the ways that we can provide different types of one-on-one time with our children versus the screen time is providing activities, whether it's indoors or outdoors. We can go to things like playgrounds. We can do some different games inside the home, whether that is some simple board games, just any kind of different activities that gets them up and moving. And then, of course, we always want to provide healthy snacks for those toddlers during any type of activities. Next age group that we're going to talk about is the school age group, and so this is 6 years and older. And so when we talk about screen time, we know that this age group, that a large part of their day is involved with screen time because of the different virtual learnings now that they are having to receive through their school. And so what we want to do is make sure as parents that we are providing still activities for them outside of that 1 hour screen time where they can get physical, whether it's going to a playground, walking in the neighborhood, maybe playing some basketball or football or soccer with that school age. It's very important for us to do that so that we help with their development. We do encourage appropriate screen time because it can assist with building creativity and connections with family and friends. And then we also want to make sure that we are involved with our child and talking to our child about what they are seeing on the screen, because there's a lot of social media out there that sometimes can be not so healthy for a child. We want to make sure that for every 1 hour of screen time that they're spending at least 15 minutes doing some type of a physical activity. Again, that can be walking, it can be jogging, running, playing basketball, maybe doing some yoga, just any type of exercise that gets them up and moving. The final age group that we're going to talk about is the teens. And so we know that teens, especially in the days that we are experiencing with the pandemic, is spending a lot of screen time because of education. And so we want to make sure that we are providing them a balance between the amount of time they're spending on the screen and the amount of time that they need for some physical activities. Teens are starting to show a lot more anxiety because of the virtual classes that they're having to do with their education, and so we want to make sure that we have that healthy balance. And so some of the things that we can do is making sure that we're communicating with our teen about what's going on, checking in with them often about how their schoolwork is coming, making sure that they are participating in social media type things, that we're making sure that it is safe media, social media that they're participating in. And making sure that we know who they're communicating with. So if you are a parent of any of the age groups, whether it's toddler, school age, or the teens, we at Frontier Health have a COVID crisis counseling hotline that is available every day of the week from noon until 10 p.m. We encourage and hope that if you are having a child experiencing problems during this pandemic, that you reach out to our hotline so that we can provide support and services to you and your children.
Please everyone just keep in mind during the time of the pandemic and also in regular life, screen time for everyone looks a little different depending on what your current situation is. We provide services at Frontier Health for kids ages 2 to 18. So if you feel like your child has changes in behavior, anxiety or depression related to screen time or any other event in their life, please call 423-224-1000, which is Holston Children and Youth Services.